Bleach veneers, what are they? Are they a new trend, or maybe a whim of our patients, or maybe a challenge of the natural looking teeth? Our new BG Dental case. Let's go. Hello dear colleagues, hello dear friends. We are back with our BG Dental cases, and today I will present you a very interesting one, very psychological one that is dedicated to BL or bleach color of porcelain restorations. And on that topic, on this case, based on this case, we will be discussing if bleach color is okay for dentistry, or it is just a whim of our patients, or maybe it's a fight between non-natural looking teeth with a natural looking teeth, and so on and so on and so on. So that is the very old case from 2009. This is the first ever case when I made bleach veneers for the patient. I would like to introduce a sort of information that during that time I was very focused on natural looking restorations, and the most bright color, most bright shade that I have ever used before was A1 or B1. But this patient came to my office with a magazine, with a picture from the magazine, and she said that, "Doctor, I want this color of the veneers. I was dreaming about them all my life. I want my veneers or my teeth to be white." So that was a request from our patient, and I was actually discussing with her that this is not natural, that you have to go for A1 at least, because A1 is also bright, but that will give you more natural looking appearance of your teeth and your smile, and so on and so on and so on. And she was actually fighting with me all this time when I was trying to convince her not to go for the white color, and she was convincing me to do a white color. So at the end of the conversation, she said me a phrase that put me into the corner, and I was not able to answer anything afterwards. She said, "Doctor, I'm an independent lady. I can make decision by my own, and these are my teeth, and I want them to be white. That is my strong request, and I want this restoration with such a shade." So I said to her, "Okay," but the problem of this case, I would like to also to share this information with you, because the case was very special, let's say. So the lower teeth were A3.5, and she asked us only to do upper jaw. And imagine if we will go for white upper teeth and we will have this A3.5 lower teeth, what will be the color disbalance? And I said to her that information, that look, what will happen with the color difference. And she said, "Don't worry, this is my decision. At least I can do a lower jaw later on." I said, "Okay, perfect." But before doing these final veneers, my condition of this deal was to perform or to make provisional restorations in white color, and let her test drive these white restorations for at least a week to make a final decision that this color will fit her, and we will go for the final restorations. I removed these composite restorations. By the way, these are composite crowns or semi-crowns, because teeth were restored with composite from all sides. We have the buccal view of the composite restorations. Also, they were wrapped around from the palatal side, so we just removed all these composite, also caries underneath. And as I said, I sent to my dental technician composite material. I had a very opaque dentine from Aesthetics, the material from Dentsply. They had Aesthetics, and the shade of material This video is about benefits that you will have from our online workshop. Presence effect. This is a unique feature by Belograd Academy that literally moves you to our training center and you can stay close to speaker. This is like over-shoulder format. The training process is filmed through the video system from the microscope, and there are two more cameras broadcasting close-up and general view. This way, you can see everything in precise details. Efficiency. Do you agree, guys, that over-shoulder workshop with detailed video and explanation is way better than regular slides? The third benefit is convenience. So basically, you don't need to go anywhere, and you can study in comfort conditions, in your home, in your office, during running exercises, from your phone, from your computer, from your tablet, and you can do anything you want with the content. So join us as we shifted online education into the next level. Is WO, which is white opaque, and they have also WE, white enamel. So I sent this to my dental technician, and he made these 6 restorations based on that composite to make them white. And we were a little bit cheating in this case because we decided to go from K9 to K9, but the whole restorations should be delivered to premolars as well. So I just made these 6 to highlight that the color disbalance between frontal teeth, posterior teeth, and also lower teeth. That was my plan. And I was expecting that after we would place this into the patient's mouth, she will say, "Oh my God, this is so ugly, this is so strong disbalance. Doctor, you are right. Let's go for a natural, more natural looking shades," and so on and so on and so on. So at the day of the provisional restorations delivery, when I was placing these veneers, the color was really ugly. The one of the most ugliest color disbalance that I have ever seen in my professional career, let's say. You will see now the difference. It's like, you know, I will show you a picture, but before showing the picture, I would like to express my feelings that time. So it's like you are driving the car for 3 nights without sleeping, okay? The night time you're driving your car, and there is a big track in front of you with a full light on, okay? And you are becoming blind. So I place these things into the patient's mouth, and I quit from my operatory, expecting that she will cry from the room saying, "Doctor, please, you are right, let's do another type of color," and so on and so on. Just let me show you the result, okay? So this is our provisionals placed into the patient's mouth. Now you understand me, right? And imagine what happened next. Instead of saying that this is ugly disbalance, she said, "Wow." She was actually screaming like, "Wow, doctor, these are the shades that I was dreaming about my life. So you are very great professional. Your dental technician is one of the best. Please do a final restorations immediately." And I said, look at this disbalance. You have a difference between premolars, the lower teeth. It's a huge color disbalance. She said, "No worries. This is what I want. Let's go for the final restorations." But I said to her, "We had an agreement with you, so you have to keep them for a week to show to everybody around, and then if everything will be all right, you will say, yeah, we confirm the shades of the restorations, and we will go for the final veneers at the end of the day. I don't want her to come back with a new veneers with a full of tears, crying and saying, "Doctor, let's replace these ones for darker ones," let's say. And you know what happened next? Instead of 1 week, she called me in 3 or 5 hours. She said everybody is happy, all relatives, friends, I don't know, dogs, cats, and everybody said that everything is all right, the color is good, so we can go for the final restorations. Okay, I gave up. And we made the final restorations. We didn't make them opaque white, definitely. We made them BL3 something, Bleach 3 color, with cutback and layering, with some, you know, characterization, some translucency. We tried to do our best to make these bleach veneers more or less natural looking, highlighting appearance of natural teeth after whitening. This was our goal. And you know what happened with this case? Actually, when I delivered veneers and my patient was standing in front of the mirror, I saw a pretty young lady full of happiness. And I became also happy because I was feeling that I'm a part of this happiness. And partially I'm responsible for this happiness. So in other words, I made my patient to be happy. And was very strong feeling that I remember still since 2009. And now I consider that BL shades of restorations can be done. For this patient, actually, they were very fitable because she's blonde, her skin is white, her hair are white also, eyes are blue. Everything was really like, you know, matching each other, and she was very happy with. And then she made up, let's say she also made lower teeth later on. And I learned a lesson from the case. Here we have, by the way, the follow-up. It is 2017. Still they are in place, by the way. So it's more than 10 years now. And I can say that these BL veneers, bleach shade veneers, they have to be driven to certain patients, considering many factors like tooth color, gingiva color, skin, eyes, all the appearance, so they can be made in very nice and artistic way. The real art here is to make them like natural teeth after whitening, so not to make them opaque white, because opaque white is really ugly. So these are veneers that I have never made. And the thing is that after her, we got a lot of patients, her friends actually, for the same request. Please do the case like you did for our friend. And we would like to have the teeth like her, or maybe even a little bit whiter, if possible. And afterwards, after this 2009, I can say that roughly 95% of all my cases are bleach cases, like BL3, BL4 we use for our patients. We make them natural looking, and we highlighting beauty of our patients with a whiter teeth and making them happy. So, my friends, hope you enjoyed this psychological conversation. I would like you to be healthy and to say if you are interested in veneer cases, in veneer techniques. This information for our colleagues. You can come to our training center for big veneer course, where you may learn everything from A to Z, from planning to bonding of porcelain veneers. Information you may find from the link below this video. And don't forget to sign up to our YouTube channel, to put likes and to comment these posts. Wish you to be healthy. May the dental force be with you. Bye-bye.